Bismillahirrahmanirrahim. In the name of God, the most beneficent, the most merciful. Please come in and have a seat, and there's space at the back, inshallah. Assalamualaikum warahmatullahi wabarakatuh. Good morning as well to my non-Muslim brothers and sisters. Peace and blessings be upon our Prophet Muhammad, and to Encik Firdaus, thank you for having us here. To the committee of CzeMSA, again, thank you very much for inviting me and my wife here. God willing, for the rest of today, or at least for a few hours, we will try our best to share our experience in the medical field, our experience as medical student, our experience as junior doctors, our experience as specialist training, and God willing, our experience as a human being as well. I will explain a little bit more about myself, just to put in context the kind of experience that I have, that I will be able to share with you, so that hopefully in the middle of the session or at the end of the session you can just ask me any questions. You know, I'm not a traditional lecturer. I'm a modern or postmodern lecturer. You can interfere at any time, you can disagree at any time, we can argue at any time, hopefully peacefully. And then hopefully we can come to a conclusion, or if we can't come to a conclusion, we come to a conclusion to agree to disagree. But hopefully I will gain as much from today as you will, inshallah. You'll see two qualifications there, because I'm doing 2 specialist training, but hopefully if I finish I will have 2 qualifications, which is in intensive care medicine and also in emergency medicine. I have already completed my intensive care medicine training, so if I go back to Malaysia now, I can be an intensive care consultant or physician, but I'm still trying to complete my emergency medicine training, which is hopefully, if I can pass my fellowship exam in the next few weeks, hopefully you can make dua for me, that I can go home and I can do a dual consultancy job. It's a lot, it's a little bit heavier than normally people will have one specialty. Some people have 2 specialties, some people they really will have 3 specialties, and these people, I don't know, something wrong. But whatever specialty you're doing, it will be very heavy, and there will be a lot of responsibility put upon your shoulder. As it is at the moment, your responsibility will be to study, to pass your exam, to get as much knowledge as you can. Passing exam is just a tick box, but behind that tick box is getting as much knowledge as you possibly can. And I agree with almost 100% with what Encik Firdaus said earlier. I'm just going to add on to his talk basically. I mean, the whole day has been set according to what he's mentioned. Oh, by the way, you don't mind if I speak in English, do you?
No.
Okay, I mean, at some point I will run out of English words and I'll speak Malay. So just putting into perspective, intensive care deal with really sick people when, in other words, when most other specialties, medicine, surgery, A&E, when they struggle to keep somebody alive, when somebody is dying in front of their eyes and they think something else can be done to help this patient, that's intensive care. Intensive care is a tertiary support in the hospital, and most of the time intensive care is provided by the anaesthetist. but there are about 10-20% of doctors who do intensive care who are not anaesthetists. They come from other specialty like myself, emergency medicine or surgery or even medicine itself. And emergency medicine used to be known as accident and emergency, or in Malaysia some places it's known as traumatology. In other words, these are the front line. Say intensive care is in hospital, you can't just go straight to intensive care. If you come from outside, from home and you're ill, you go to emergency medicine first, or accident emergency first, and then accident emergency is a front line who try to deal with all sorts of problems. Every specialty, medicine, surgery, you're going to learn Paediatrics, Orthopaedics, psychiatrists, they're going to try and deal with all these problems first. If they can't deal with it, can't sort it out, then they provide all these specialists, refer to specialists. And obviously, if everybody can't do anything, the patient is too sick, then you get your tertiary referral, either intensive care or transplant unit, or there's quite a few other tertiary services. Intensive care is one of the tertiary services. So bear in mind that is mainly the background I'm coming from, and hopefully inshallah the rest of the talk we will talk in a little bit more general. Obviously the subject, if we go back, is I was given this subject. That's actually two different subjects, or two different slots, because this is a 2-hour slot, but somehow I combine it into one, and hopefully we can talk a lot about this. And if you get bored or anything, feel free to put up your hand and say, I'm bored already, can we go for a break? Then that's fair. There's no point continuing on something that you're not benefiting. Is that correct? Yeah. And then we can stop, walk around and have a drink, whatever, and then we can come back if you want me to continue or not. So qualities to survive in the medical field. Medical field is very difficult. I don't know whether you know this already. Okay, and I graduated in 2001. Since 2001 until now, I've been sitting exam at least once a year. Alright, and I'm not finished yet. And I'm one of the youngest intensivists in the UK when I was training there. Alright, so it is a long road if you want to be a specialist. It's a long road. Certain specialty, the training is relatively shorter, and if you're a genius, you can pass your exam first time round. Then it's slightly shorter. The shortest, I think it can be up to 7 to 8 years, but in general people take about 10, 11, 12 years to finish the whole thing, to become a consultant. And I'm now year 10. I'm nearly there, but not quite yet. There's one more big hurdle, just at the end. And hopefully after that, I can think about going to Malaysia, helping my countrymen, building new intensive care, building new emergency department, and all these things. So it's at a different level of thinking, but we'll go through, I'll talk through all this progression in life and in medical career. But before we can start thinking how difficult medical life as a medics are, or life in medical career, we already have something in common with everybody else running on the background, which is life. We already have the complication of life running on the background. We all have our baggage, and we all have standard things. This list on here is not exhaustive list. These are the things that while we're doing medicine, we are doing this anyway. Obviously, as you progress through life, more things are added up to this list. As one child is born, you add one more, and then more and more and more. Extended family in Malaysia, extended family. Every other weekend there's kenduri kahwin. You know what I mean? And then you can't do. You have to go. You have to respect your family. And then there's a big component here. This component at the bottom: community, charity, and religion. I put it down there because most of the time is this component that gets sacrificed when you get too busy. Alright, so you might want to highlight, and also the environment at the end, even more sacrifice when you get too busy. You can see the effect in the world nowadays, the global warming, the running of a fuel supply, the all sorts of problems, the running short of food supply, and all sorts of problems in the world. So as things get busier, as we get busier, we sacrifice these 4 things at the bottom. But in reality, it shouldn't be so, because this is the very crux, this is the very heart of society. These things: community, charity, religion, and environment. Environment is very important. I don't think there's any true green hospital in Malaysia here. In Germany, the other day, a friend of mine, an architect, he was invited. He won a scholarship. He was a UITM student. He won a scholarship to go and build the eco-friendly hospital in Germany, where everything in the hospital is recyclable, and it's almost zero carbon footprint hospital. I don't think in the UK we don't have a zero carbon footprint hospital yet. In Malaysia, far from, I think. but there's an opportunity for you to develop, inshallah. Okay. And the other thing that I would like to highlight, from a few that Cik Firdaus said, it's very important that you have to pick up other things as you go to medical school, because you will not have time to pick up these other things during other time in life. You might think you're very busy now, but it gets worse. Alright, so management. Try to understand management, try to understand finance, try to understand technologies, try to understand IT, blogger, I bet everybody's on Facebook, but that's just a tiny, social networking. All these things are very important because it will have implication. The implication now might be small just in terms of organization, society, but later on it have the bigger implication as in our life. Am I making sense here?
Yes.
Okay, so we are going to be talking here at a higher philosophical level, okay? Because I'm sure you already had enough of anatomy, physiology, histology. What cell is this? Can you draw it? Cells. So now we're talking. Today, from me anyway, we're going to be talking at a slightly higher philosophical level, things that you might not hear so much, and hopefully later Dr. Nurul will talk on a little bit more practical level in terms of choosing specialty, and Dr. Ilfita will talk about in general life, and maybe she might want to raise it up higher, to a more higher philosophical level. Right, this is even more philosophical after this. Of course, all those components just now, we think about life, how heavy it is. But there's only one certain thing in life. There's only one certain thing. Everything else in life is not certain. Who disagree with me? Alright? Death is certain. There's nothing more certain than that. What's uncertain is the timing of it. We don't know we're going to die today, tomorrow, later, at age 70. You can do epidemiology and look at population average and statistic and say the average age of person, or average age of a person or a man in Malaysia is what nowadays, 65, is it? Because a lot of Malaysian men die young, heart attack, coronary artery disease plus diabetes. 1 in 10 Malaysia diabetic. Or if you are a British citizen, your average life expectancy there as a man is about 75. It's a lot higher health status, higher healthy. So you can't use population average. You can't use epidemiology to describe death, because this is a very personal thing. So, driven by the certainty of death, in my opinion, all your decisions, being in life or as a doctor, should keep this in mind, either for yourself or for your patient or your family or for your relatives. Okay, and because of the certainty of death as well, this is why we have religion, because we want to prepare ourselves. Even if to some of you here might have different religion, you have different concept of death and life after death, and even if you don't have a religion, some of you here, the non-Muslim might not have a religion, might not believe anything, you have some sort of faith, you have some sort of belief, you are influenced by something. Your ideas and thoughts are not just purely yours, it's something from what you read, isn't it? Obviously Muslim influenced by Quran, Christian influenced by Bible, Jews by the Torah, and then there's a Rig Veda, and of course even people who have no religion or no belief, their belief and faith is influenced by some things. something or some opinion, some group of people, something. My advice is if you have whatever belief, make sure you have the good and you really understand your belief, because it leads to accountability. Having a law saying that if you give the wrong medicine to this person, or if you do the wrong treatment for this patient, will deter a lot of things, but unfortunately it will also make people hide things under the carpet. They've given the wrong medicine, alamak ni okay, tak mati ni tak apa, okay, buat tak tahu je lah, I don't need to tell anybody. Okay, so people can still get away, you know, legal, but having accountability, you know, if you think, you know, oh my god, I've given the wrong medicine here, you know, am I accountable for my action? You know, what am I supposed to do now? I should learn more. I should go to the patient. I should apologize. How many doctors go to the patient and apologize when they did a mistake? Alright, there's not many. It takes bravery and takes accountability, and this comes back to your faith and your belief. And then it brings a question, all these other philosophical questions, you know, maximizing your time on earth, bukan okay, enjoy maknanya. It means you have to do a lot of good, okay? You know, what you leave behind, your inheritance, you know, your children, what do you teach people? Again, implication in medicine here is huge. You just become, you leave, you know, you leave behind good health, you establish a good health promotion, you start a new hospital, you know, you do all sorts, you know. These are all part and parcel of religion, and it's part and parcel of being a good doctor as well, part and parcel of having a good faith. And then of course, you know, why are we here? You know, for us Muslim, you know, wama khalaqtul jinna wal insa illa liya'budun. You know, of course, you know, most of us would know that, you know, we are here to be a servant of God, and that itself have a big implication, including in medicine as well. And then of course, you know, we believe in destiny. Okay, things already written for us. Things already written, whether we fail or we pass exam, whether we become good doctor, bad doctor, but we don't know about it. Right? We don't know about it. So in our head, think positive, we are all going to be good doctors. Any questions? Any disagreement? Okay. Right. So having at the back of your mind that we are also a human being, that we have lots of life behind of us, inshallah, we also have death to think about, and the philosophical questions why you're here, and this should really consolidate our attitude. As Encik Firdaus said, becoming a doctor, our feeling and the main objective, what we are. How many of you here know that they really want to be a doctor of medicine from the very small age? Put your hands up.
How small?
From very small age. Wow, this is okay. From very small age. Yeah, I keep small very vague, because, you know, it depends what age you start to think. Some people quite, you know, later than others. Okay, this is no problem. You know, you can catch up. How many of you are doing medicine because they are given the scholarship to do medicine, but they actually applied for something else? Don't be shy. Okay, I wanted to be a genetic engineer. My strongest subject has always been physics and chemistry and a little bit of biology. Okay, and I got one scholarship to do engineering, but after that I got one scholarship to do medicine. I said, oh, let's try medicine. But it doesn't mean you can't change your attitude as you go along. It doesn't mean you can't change your niyyah. Okay, it doesn't mean, because you will find things that you enjoy along the way, and then you start to understand why, and then hopefully, you know, you understand why you do things, and then you do things correctly or the right way. You try to achieve the right objectives. Okay, objectives you can set at the beginning, try to arrive at the end, but most of the time you don't really know what the objective at the end, because as you go through life, more objective is added into your list of objective. The keys here is to progress, to keep adding more objective and reasons to do it. And this is how you progress. This is how human being progress. When I was small, you know, I was my mom's or my dad's son. I was my sister's brother. That's it. And then when you go to school, I have my clique. I have my clique school. Okay, at school, this is, you know, my friends at school. We play together. And then as I get a little bit bigger, and then suddenly people say, "Oh, you are Malay. Oh no, this is Malay. This is Chinese. This is Indian." You know, you start to identify with bigger groups as you get older, as you get more understanding, and then suddenly you say, "Oh no, we are Malaysian." You know, we are Malaysian. You know, you have, you know, all different groups, and we are Malaysian as you go abroad, and then suddenly when I arrived in the UK, I said, "Oh well, we are Muslim. You know, I'm Muslim. You know, we are even bigger. You know, the group get even bigger." And then now, you know, over years now, you know, I'm a human being. It comes full circle. I'm a human being, right? It doesn't really matter how the way you arrive it. You should arrive it as a human being, because when you're a doctor, when you treat patient, okay, I found it through religion, and I found it being through a doctor as well. When you treat patient, you can't treat, oh, this is Indian, this is British, white, this is immigrant, Polish worker in UK. You can't treat, oh, this is a pekerja Indonesia kat Malaysia yang tak ada permit. So he have to wait at the back of the queue walaupun his brain is coming out of his ears. Which happened. Okay, just share experience. You know, I went to sit in with my friend neurosurgeons in Malaysia, and then we were, you know, operating on somebody who's got a, you know, a broken head. You know, and then he said, "Oh, what's he see? What is he? Oh, he's an Indonesian, no permit. Ah, yeah, give me a cheap spare part," jokingly. But the nurse gave him a cheap spare part. But you have to put in mind as well, there's financial constraint. But what I'm trying to tell you is that you need to know what the ideal. Because this friend of mine is forgotten what the ideal is. It's practical, it's realistic, it's what you should do. Every country have got its practical and realistic, but practical and realistic will come with time. What's difficult to get is the ideal. Everybody keeps asking, what's the quality of life of doctor in Malaysia? What's the quality of life junior doctor? What's the quality of training? Okay, that will come as you find it. But what will not come is the ideal. The ideal you need to learn. You need to learn the ideal. You talk to people, people will tell you, you should do this, like this, like this, like this. If you learn religion, this is what you should do, like this, like this. If you learn philosophy, this is how you think like this. If you learn cardiology, oh, this is how you treat heart attack, you do this and this and this. But most centers in Malaysia can't treat heart attack like we treat in the UK. It doesn't mean that you don't need to know what the ideal is. Knowing the ideal makes you work towards the ideal. The ideal can be from the science and technology point of view, evidence-based medicine, can be from philosophical point of view, can also be from humanity point of view. Who you treat, you know, you should treat all human beings the same, really. And the British Army, some of my friends who's in the British Army medics, you know, when they go to Afghanistan and to Iraq, you know, during the war, I have high respect for their humanity, because they don't only take British Army or American Army into hospital, into a British or hospital base. They take everybody there. If they fight there, they have war between the Taliban and the British, and everybody's injured from there. When the war settles, take everybody, go to hospital, treat them next to Taliban, British, American. Not even a border. Okay, so this is the kind of, you know, you have to learn sometimes the good things from the least expected places. Okay, again, open your mind and you will pick up these things along the way as you go through your life and your training. Natural progression of medical student or of a doctor, obviously in this order. Not everybody will arrive at the last one because this is just a filter process. It's like a pyramid. Even at medical school, you know the reality is, the pyramid gets smaller as you go up. That's part of the thing that you have to accept. If you are interested to be a GP or general practitioner, it doesn't mean that after medical school you just go and do a GP. Not anymore. It was like that in Malaysia. Now they're changing it with One Health primary care. It's quite a few of my friends who came back from the UK, Malaysia, working for UITM now, are establishing Malaysia primary healthcare system. And under this system, all the doctors have to be a registered general practitioner or family medicine, because after medical school it is just not enough for you to go out there and start treating people in the community, because treating people in the community is not about treating demam and batuk and rashes. Betul tak? Itu you don't need doctor even. Okay, GP and general practice in community is about treating chronic illness yang orang tak rasa sakit. What are chronic illness that people don't feel ill? Give me an example. Sorry?
Back pain.
Yeah, back pain. People feel pain. They go to clinic. So what is a chronic illness that you don't feel ill? Diabetes, stress, hypertension. Alright, so asthma, sometimes you just a bit. So there's a lot of chronic illness. So GP in reality should treat chronic illness before they become bad. So what's happening in Malaysia, the clinic and all only treating batuk-batuk, sakit jam ni, they don't do the basic primary care thing, which is why hospital get inundated with people who become very ill. So this is why now there's a big effort in Malaysia to try and shift at least 30% of the workload back into the community, because a lot of the asthma exacerbation, a lot of the hypertensive crisis, a lot of the myocardial infarction, a lot of strokes, a lot of diabetic crisis, DKA, or hyposmolar ketoacidosis. A lot of it to a certain extent can be prevented or can be controlled. Chronic kidney disease, CKD, you learn all this level. It can be prevented. So this is what GP should be for, general practitioner, family medicine. If you're interested in preventative medicine, you're interested in looking after a family or patient throughout their life, and they keep coming to you, then family medicine or general practitioner is for you. But you have to learn at least 3 or 4 years to do this. You can't just jump straight away from medical school, and you need to get qualification. That is the current recommendation by government of Malaysia under the One Health healthcare system. It should be launching soon, and they are looking for about 4,000. Yeah, around about 4,000 general practitioner to cater for the whole population of Malaysia. At the moment, we only have about 1,000 plus registered. The older general practitioner in Malaysia who's been doing it for years and years with no formal qualification, will just get a recertification. They need to do, and they need to know what blood pressure medication to give, whatever. Some of them we probably know anyway, but we just need to make sure that it is okay. So that's an example. That's a GP. The rest of my example in here is specialist training in hospital. Alright, GP sits here because that's in the community. On this side here, you've got everything else: emergency medicine, psychiatry, medicine, obstetric, gynecology, pediatric. Everything else is really hospital medicine. So a lot of the basis of my talk after this will be based on the premise that the training is hospital based rather than GP based. So you go through training, specialist training. Myself, I'm now sitting in between point 3 and point 4, somewhere there. and hopefully inshallah, you know, we kalau ada rezeki, you know, we can progress. Okay, so I'm just gonna quickly go through a certain example at every steps, just to highlight the kind of challenges and the kind of qualities that you should have. Okay, so you are a third year medical student. Oh, by the way, can I see a raise of hand? Who's first year here? Who's first year? Put your hands up. Hi. Okay, who's second year? Okay, who's third year? Okay, who's fourth year? Okay, who's fifth year? This is maximum, is it? No, 6 years. It is amazing because it's almost the same amount every year. Okay, and it's very reassuring to see that, which means, you know, you are aware of this kind of program, and you do attend, even though you don't know who I am, you know, just come in and see what you can gain, isn't it? A lot of the time in life, you don't really know what you're getting yourself into, isn't it? This guy might be a maniac, you know, come talk about some rubbish or whatever, you know. But then, you know, and then you have a leap of faith. You just come, you trust your friends, you get it from the good source, you know, you trust, you know, and Cik Firdaus, Cik Firdaus even don't know me, so he also have to give a leap of faith. Habimi also don't know me, you know. But then again, you know, this is what social networking is all about, you know. Hopefully, whatever speaker you have is not just random Joe Bloggs that comes and sits in front of you, I think. So you're a third year medical student. You've been very successful at school. Asyik dapat nombor 1 je waktu sekolah rendah. And then even at school, you know, UPSR 6A's, you know. Oh, whatever. Is it UPSR? Yeah. There's no more UPSR, no? 5A's. Oh, and then PMR, you know, SPM, whatever, you know. And then everything, you know, I fly. First year medical school, okay, not too bad, past year. Right? And suddenly you find yourself stumbling in the third year. Apa sini ada 3 attempt kan? 3 attempt. 3 is banyak. So hopefully more than enough. Right, so you're resitting exam in 2 weeks time. So even from this very simple and realistic scenario is already, I don't need to tell you what are the challenges here. It's just self-explanatory already. Okay? It's just self-explanatory already. You have to, you know, somehow find another strength. If you're a marathon runner, you want it in the last 2 kilometers, you need to somehow find a strength from somewhere. And you don't need me to tell you that, because everybody have their own way to do it. So there you go. There's no point just studying smart. Okay, it's just the volume is just so much. Whether you like it or not, you have to study hard as well. There might be some geniuses among you, but you know, you in general, you have to do all this. Those things, those 3 things at the bottom, you know, don't forget. Okay, don't forget. Those things go a long way. Those 3 things at the bottom goes a long way. You know, who's here have a regular exercise session, you know, gym or playing football or whatever, you know. It's good, because as if you want to be a surgeon, you have to be super, you know, you have to be gila fit, you know. You know, no joke. Because, you know, if you're a surgeon, even after your consultant as well, you know, you have to come in the middle of the night to operate on a AAA, you know, aneurysm, abdominal aneurysm, ischemic limb, to operate on this, because chances are your training is not adequate to do this. You know, they can do during daytime, but not out of hours. You have to come in. So whoever, you know, obstetrician, oh, you know, there's so many deliveries in Malaysia, so many complicated case. You have to be, you know, you have to be fit, and then to be fit mentally, you really have to be fit physically as well. Okay, and these are the things that get sacrificed when you get busy. Alright, just remember that these are the things that get sacrificed when you get busy, when you get stressed. Eat well, okay? Eat well, good food. Okay. Of course, the very simple definition of good food is for Muslim is halal food. But then again, even halal food now, people are questioning. We have to think the ideal here, right? Many halal shops in Malaysia, in the UK, they sell battery farm chicken. Do you know what that is? My wife told me about this, so I like to use example. This animal is stressful. They have been kept in a cage so small that they can't even move. They can't even move. From the small until they're big, they're in there until when they get slaughtered to become meat for us to eat. And you can tell this because sometimes when you buy chicken at the shop, they've got blister on their legs. I don't know if you notice blister on the chicken legs. Right, this is just one example that even though the chicken is halal in terms of the way it is slaughtered, but you think about it, could it possibly be that this chicken will be halal because we've been maltreating this chicken the whole of its life? Example for you to think. Alright, same with every other things. Agriculture, when you eat a vegetable, okay, when you eat a vegetable that arrive from an exotic vegetable, say in this country, okay, that arrived from Kenya, West Africa, somewhere, okay, how many cent do you think the farmer over there gets, and how many ringgit or pound do you think the middle person or the supermarket gets? Even though it's vegetable, but it's just something to think about. These are not the well elaborated of the concept of halal and haram, but it is human. You see this higher level here, we've already gone to that. It is all there, but it's just lost in translation. Okay, might be difficult, but again, know the ideal. There's nothing wrong with knowing the ideal. Okay, and also your recycling, your bin. Is there a good recycling process here? Yes. Yeah. So exactly, recycling is is very popular, isn't it? You recycle your organics here, your boxes here, your glasses there. So this is also things need to take off as well. Personal development, right? The organizers of this event, this is the one step. This is the step. Student, activism, student charity, student organization. These are the stepping stone for you to learn about organizational behavior, about politics of engagement, how to engage with Encik Firdaus, how to engage with HICOM, how to engage with IMAMUKEIRE, how to engage with political parties who have vested interest, how to engage with corporate firms who have financial gains. Alright, you can only start doing this if you're involved in, as I said, these are the things that get sacrificed when you're busy with exam. But know your priority. If exam is priority, exam. There's no other way about it, because you need your degree. Right. So now you graduated 6 years, go through your viva with some professor, and then they say, "Oh, you okay? You pass," and then you start working. You are in. You were posted. You reach home to Malaysia. You had a 3 or 4 months rest while waiting for MMC registration and MMA registration, and then suddenly you were posted in hospital Tuan Puan Rahimah. Is that in Klang, isn't it? Okay. They call that place a war zone, right? So you should be privileged if you get posted there, I think. So you are doing your first set of night shift as a newly graduate doctor. A nurse bleep you. Every doctor carry a bleep still. I don't know why they're not moved on to mobile phone. Still bleep. We are in 21st century now. A nurse bleep you because one of the patients in gastroenterology ward who is receiving a blood transfusion has dropped his blood pressure to 70/40 millimeters mercury. It's 2 a.m. in the morning. You just sat down. You're very busy. You started shift at 8 o'clock. You just sat down to have some roti canai in Malaysia. Okay, roti canai, in your room you have frozen one or whatever, and drink some coffee. What do you do now? Nurse is on the phone. Roti canai there, coffee there, nurse is on the phone. Dia cakap, doktor, this patient in the gastro ward, dia drop dia punya blood pressure. What do you want to do now?
Take one last bite.
That's not a bad answer, because if you faint because you're hypoglycemic or you don't have anything to eat, is that good or not?
No.
It's bad for you and the patient, okay?
Yeah.
But maybe not try and finish the whole, maybe just one bite, just jamak je, and then go. And then while you're walking to that ward, which is about, you have to cross the road and all, what are you thinking? What's going through your head? What are you going to do now? What's the problem here?
What should she do first?
Absolutely. Having a bite, don't put the phone yet. Okay. What you telling the nurse? Okay. 5th year. 5th year. Okay. This is where the knowledge comes. Alright? It's obvious that we don't have enough knowledge. We cannot make a decision in that 10 seconds. Alright? This is what it comes down to. This is not Viva anymore, when you have a few minutes to think about things. Okay? This is when the knowledge has to come together, and this can happen on your first night shift, when you are on your own looking after 4 or 5 wards. Each ward have got 20-30 patients. Alright? So all the 6 years of viva and grilling and stress comes down to a few seconds of telephone conversation with the nurse, which is about 5 blocks away. So how should you approach this?
So pressing.
Right. Okay. Right. So the approach is, very quickly in your head, you should already thinking what the problem is. Alright? Okay, what's the potential problem here? Why is the BP drop? Sorry?
Gastroenterology may be bleeding.
Absolutely. Gastroenterology what? Might be bleeding. Patient might be bleeding, isn't it? Upper GI bleed or lower GI bleed. What else could be going on here?
Heart.
Yeah, it could be a heart problem. It could have a heart attack and then a MI and then BP drop. What else could be going on here? Shock might be, because been in the ward for so long, maybe in septic shock, blood pressure drop. What else could be going on here? Anything more? Transfusion reaction?
Allergic.
Yep, allergic reaction to blood, transfusion reaction to blood. How many of you thought of this? If you've not asked the nurse to stop the blood transfusion, by the time you arrive to the ward, it's too late. You don't know. Alright? So, all these things, within that 15 seconds, rushes through your head with all the adrenaline pumping through your brain, and then you said, stop the blood transfusion, keep all the blood packet, start some resuscitation fluid on the patient, 500 mils of gerofusine or Volplex or whatever fluid you use, run it straight in, put the patient on 15 liters oxygen, because if the blood pressure is low, circulation is low, you need to deliver more oxygen, so give more oxygen. I will be there in 2 minutes, so you need to do that in 10 seconds. Are you up for the job? Alright? So this is what is at stake here, not to scare you or anything, but this is reality. Everybody have to go through this. Okay? How many house officer or newly graduate doctor will know to do that in the first few weeks? I ask you, how many? See, after you've completed 6 years here, do you think you'll be able to respond like I've just done that?
No.
You're right, no. After I graduate, was nowhere near to be able to respond in that manner. It's just too much. Alright? So, if you don't know it, don't despair, because I didn't know it. Because that's just normal, okay? But the lesson from this is you should be stressed about it. See, a lot of people, they say, okay, I'll be there. Just put the phone down, get one, grab one bite of your roti canai and walk to the ward. Okay, and arrive there, patient is still low blood pressure, and then you start doing, okay, let's just do this, okay, let's, maybe transfusion reaction, then it clicks, then, let's stop the blood because the patient is not bleeding, or if the patient is bleeding away, then this is bleeding, so you give the blood quicker, get more blood, you see the patient. So the patient, the end result might not come to any different. The patient might still be okay, but the more, the good attitude of you will pick up on this lesson and say, I need to be quicker, my decision next time got to be more snappier, I need to consider all the more differentials, okay? Which is why some people might not like hospital medicine, like to go into GP, where okay, makcik sakit apa, care about blood pressure. So this is two completely different world, okay? Hospital medicine and GP world. So there you go. This is your challenges. You're tired, very busy, lapar, nobody cares. You hear lots of stories, you kena maki lah, kena marah, kena jerit lah, pregnant lah, beranak dalam lift lah, all sorts. Maternity leave pendek sangat, all sorts of cerita. You can hear all this nasty cerita till the cow come home. It doesn't really matter. This is your challenges. It's going to happen to some or most of you one day or another. But then again, don't forget certain points in there that's going to be left out when you a doctor. This is just a flavouring of the junior doctor, because I think Ilfita will explain a little bit more in more detail. Right. So if you not already have an interest, this is during your junior doctor years is when you start developing interest. I want to be a gastroenterologist, okay, dealing with bleeding people, because I do enjoy that a lot. So some people might decide that this rushing is not good for me, I don't want to scope people in the middle of the night, put the scope down, I just want PGP. So it might be different that you decide. Who have already decided here what they want to be? Higher. Okay, that's very good. That's very good. That's very good. Why is it very good to know what you want to be early?
Everything you learn is directed towards you.
Absolutely. So that everything you know or everything you should know should be directed towards what you want to become, right? Medical school in the 30s, 40s is 5 or 6 years, okay, duration. Medical school now is 5 or 6 years duration. Logic ke tak logic? Logic ke tak logic? The amount of medical school time is the same 80 years ago and today. Does that make sense or not to you if you think about it? It does not make sense, because over the last 8 years, God knows how much development has been in medicine. If you go to the library, every single month there's about few hundred journals from every single specialty. Gastroenterology itself ada 5, 6, 7 journal, British Medical Journal, the Lancet. Every single journal is knowledge, new knowledge coming through on a weekly and monthly basis. How is it possible that medical schools still remain 5 years in the UK, 6 years here, 5 years in Malaysia? Is that possible or not? It doesn't make sense, but the people who do the curriculum have to make it work. Nobody wants to go to medical school if you have to learn 10 years. So what I learned at medical school, how to treat heart attack, how to treat myocardial infarction, changed when I graduate. As junior doctors, the treatment to treat heart attack is different. And then when I'm an emergency medicine specialist, the treatment to treat heart attack is different even more. And the difference is not bukan kecil-kecil. The difference is like, do something else, or don't do this, because we've now found that this is bad. Alright, so which is why a lot of medical school nowadays is cutting back a lot of the basic physiology, basic anatomy. If you go to the UK, to the US, they've cut back a lot of this, just to make room for new development, just to make room for projects, so that people with interest can concentrate what project to take up. If you want to do cardiologist, you know you want to do cardiologist, every year there's certain project you can take up, cardiology project. If there's no such system in this university, then you just have to have a mindset of your own. I want to do cardiology, so I go through this medicine, I pass it, basic, I need to pass, but in this subject of cardiology, in this subject of the heart, I want to know more. That will go a long way. A long way. Okay. Are we tired already? No? Are we still listening?
Yes.
Tak ada tidur? Right. Scenario 3. So you've survived junior doctorship however many years, 2 or 3 years. You did quite a lot of mistakes at the beginning, but you are very good attitude doctors. For every single mistake, you go and apologize to your boss, and you go apologize to the patient. Okay, this again ideal scenario, right? Always have the ideal. Okay, and if the boss maki you whatever, you take it, this is a lesson for me, I need to be a tougher doctor. Occasionally you might go away and cry in some corner, but that's fine. But then the attitude you put yourself, when I be a consultant, when I be a specialist, I don't want to be like my consultant now. He's so cruel.
Yeah.
Right? Because there is this system of bullying is not sustainable, right? It's not sustainable. Even Gaddafi will go down soon, alright? So thank God he's not a physician, so that you are now the urology specialist registrar on call. You know urology is, yeah? What is it?
Kidneys, urinary tract.
Yeah, urinary tract specialist, as it were. Urology specialist registrar, which is in training, on call. The senior nurse call you because the junior doctor in the ward have been trying to insert a urinary catheter in a man, okay, for the last 30 minutes, okay. And then nurses call you and say, doctor, patients kan dah bleeding junior doctor ni dah try dah half an hour tak masuk-masuk pun catheter tu. Patient tu dah uncomfortable and then dah start bleeding dah sekarang. Alright? It's during daytime, because you're very busy, your responsibility increase as a specialist training. You in clinic. Your clinic ramai. 30 people book in to see you in clinic that morning. Right? So patient already started bleeding, right? What do you do now?
Tell the junior doctor to stop.
Alright, junior doctor already stopped because he was already bleeding.
Senior nurse take over.
Senior take over? Any other answer? Sorry? Yeah, that's right. So you want to know how ill very quickly on the phone. You need to prioritize. So this is now your prioritizing skill. Again, skills that you pick up at medical school, whatever, your prioritizing skill. 30 patient in clinic versus 1 patient bleeding upstairs and no what. Which one do you want to attend? Alright? So you need to make a decision as usual within that 10-15 seconds. Always seconds, we're always talking seconds, maybe minutes if you're lucky. Right? So you have to use, what's the blood pressure, how's the patient doing, is the patient awake or unconscious? Is the patient unconscious? What does that mean? Absolutely, that means there's not enough blood flow to the brain. That means the blood pressure is low. That means it's been bleeding quite a bit. Might not be outside, might be into the bladder. You can't see the blood. Alright? So again, you look for clues on the phone. You learn 7-8 years already, and then you look for clues on the phone to try and make your decision. And then of course you decide the patient bleeding is not too bad. You can finish your clinic, and then you said to the nurse, leave the patient alone. Patient is comfortable, BP okay and everything. I don't need to come now, I come up later. And then you come up to the ward later. What do you do now? What's the first thing would you do? Kaya you see the patient of course kan? Ke pergi maki house officer dulu? Who would do that? See attitude? Siapa yang akan pergi maki that house officer dulu? You shouldn't do that. Go and see the patient first. Go and see the patient first. Make sure the patient's okay. Make sure if you need to put another catheter in. Make sure if you need to organize a cystoscopy guided urinary catheter insertion, or maybe you decide it's not for that. Maybe we need to do an emergency suprapubic catheterization. There's a lot of options. Obviously, this is specialist knowledge. You will know hopefully by this time. But even if you don't have a specialist knowledge, you can still answer. Sort the patient out first, number one. Second one, clarify with the nurse what's happened. Third one, if it's already clear that this is the house visitor, go and talk to that house visitor. See what's happened, what's going on, why didn't you ask me for help, right? And then after that, you maki him or her ke? No, you look at his learning objective, because it reminds yourself of when you were house officer last time, a lot of things you don't know to begin with. Okay, you go through, have anybody showed you how to do catheter before? If nobody showed you, why didn't you ask me? Okay, you highlight the learning objective, you say you should grow in this. You be responsible of your juniors. Okay, junior doctors are not responsible for anything. You can do dog damage, but it's a senior that pick up the problem. That's why they maki all the time, because it's a senior punya nama, your name is not. But then as a senior, you need to understand, just clarify things. You see, there's a lot more things, maki and shouting is not really in there even. Okay, again, know the ideal. If you don't know the ideal, the first thing you do is maki the junior doctor. Right, so as a specialist in training, you have more clinical responsibility, professional examination, as I was telling you, even until now I've not finished doing my exam yet. Dissertation, you have your dissertation, you have your viva dissertation on certain project. You need to know how to read papers, you need to know how to understand statistics. My wife understands a lot more than me. You need to understand what treatment works, what treatment doesn't work. You need to understand what is a significance and result. Management, clinical and management course. Now you're responsible for clinic. There's a little bit more. You're responsible for the ward. You're responsible for your junior doctors on the ward. You need to teach. You need to know how to teach, how to speak at the front. How to teach. If you teach medical student and junior doctors, and you continue to have your supervision with your consultant, because you're still sort of ongoing training. And then you perfecting your skills, overall skills. Okay? Ada lagi 2 level. I'm just giving you all this to show you that every single thing that you pick up from now on until then will contribute to how you are or how you behave, to your attitude. Alright? Because at that stage, as a specialist, nobody is going to tell you to behave baik-baik. Is anybody going to come and tell you to behave baik-baik? Your consultant also up there can't go and tell you go behave baik. If I'm there as well, I can't go and tell if you're urology specialist to behave baik. The only time I can tell, and I have a little bit of advantage to tell you how to behave properly, is now. Which is why I'm doing so, and which is why Cik Firdaus is doing so as well. Because at some point, our egos will all be big, we will not be open to anymore. But is that good or not? No. Know the ideal. Again, I wonder how many 100 times I've said that anyway. Right, so scenario 4. You are the accident and emergency medicine consultant on duty. So inshallah I'll be one of these days if I pass my exam. Make dua again. It's Friday night. The department is very busy. Okay, you are in UM. This is UMANE, next to the Federal Highway. There's a note on your table by your consultant colleague saying the night specialist registrar, which is the trainee specialist trainee registrar, have not handed his criminal record check certificate yet. Right, so every doctor who have to work have go through a lot of checks. Okay, because everybody gets transferred everywhere around the country. So in reality, everybody have to have checks. Because you don't want just any doctor, because in Malaysia nowadays there's a lot of doctors we import as well, from Bangladesh, from Vietnam, from India. So Who checks these doctors? How do you verify? You don't know them. So there needs to be a robust paperwork system, okay? So your colleague during daytime leave you a piece of paper on your table saying, you know, this doctor whatever, have not had his checks yet, he's coming on shift tonight to work with you, okay? Obviously, I know that, you know, I will go home at midnight because, you know, I'm a consultant, you know, I work midnight, I go home, I on call from home. If they have problem in hospital, then they'll call me to come in. So, what do you do now? Department's busy like crazy. Right, common sense now kick in. Believe it or not, you do not have to be a consultant to make that decision. Again, things that you gain from now. Hopefully, within a few years, you know, you gain more knowledge. So, who want to give an answer? What do you do now? Who do nothing? Angkat tangan. Who do nothing? Alah, nothing. How many kat Malaysia yang you think will do nothing? How many do you think will do nothing? A lot. Many. Because this is hustle. This is hustle. You think, you know, oh, deal esok lah. Alright? Deal esok. Okay. Even when you think now, you think, oh my god, how many will do nothing? Even you tak payah genius lah, you already think that quite a few people will probably do nothing. Is that the right thing to do? No, because again, it comes back to your belief, your responsibility towards patient. As a consultant, you are responsible to the patient that come through your department, whether you see them or not. Your junior doctor buat tai ke, your registrar, your trainee, whatever, it is all your responsibility. If you know that this doctor that is coming to work on your ward, if you know that you don't know him and somebody left a note on there said they can't verify his check, is it responsible or irresponsible for you to ignore it and just let this doctor work all night seeing all these patients and then you go home and sleep? It's irresponsible. Walaupun it will turn out okay, you know, it might turn out okay, the next day might be no problem, you know what I mean? It might turn out, but again, know the ideal. The ideal is you cannot just leave it, okay? Because if anything happen, you know, you will not, you know, you cannot justify in your heart. Obviously, legally, it will come down on you like a ton of bricks juga. Because why didn't you check? But again, legally, people get away with it if nothing happened. But in your heart, okay? So this is one of those times that you probably have to say, you know, registrar, you cannot work tonight. I have to verify your checks tomorrow during daytime, and tonight I'm going to try and find a spare doctor. Gonna call around, see if there's anybody available who can come and fit. If there's nobody available who can come and do, I have to stay in the department myself, even though I've been working for the last 16 hours. I have to work until tomorrow morning. Okay? Now this is different level now. This is responsibility at different level, okay? But again, the basis of it, the asas of it is from now. So as a specialist or consultant, you're accountable for patient care, whether the ones you see or whether the ones you don't see. You're responsible for all your junior trainee or your junior doctor actions and behavior, okay? And you are responsible to give example. If you give example, maki marah, maki hamur, baling note, then your junior will behave like that, lah kan? But then remember, you are ideal junior. You know that, oh, this consultant is stressed. I'm doing something else. Okay, so you have to change the wind. Okay, Malaysia is going through a lot of changes nowadays, and inshallah, hopefully for the better, but it won't be easy. Managing risk. As junior doctor, you managing risk to your own patient. As a senior doctor, you managing risk to somebody you know you've seen before. And this is the way your management is. How do you delegate things? How do you make sure things are running well? These are the skills that nowhere in medical school that they teach you this. Scenario 5, ada lagi satu. You are now the head of Department of Anaesthesia and Critical Care Division of Selayang Hospital, say for example. You receive a letter saying that because of the economic downturn, the government have less money. The hospital is cutting down the department's next year budget by 10%. Alright, what's going through your head now? Ini lagi lah tak ajar kat medical school kan. Hopefully over the years of you going through your training, you would have picked up. Even throughout your training, there will be no formal training of finance. Nobody gonna send you to financial class. Nobody. Even now, all the things I know, I've picked up along the way, bits and bobs here and there. Again, the reading outside medicine is huge. The management, the reading is just huge. It's just immense. I have more books now in my house than I ever had during my medical student years. Tak baca pun most of it. But anyway, the idea is you need to know a lot. Okay, what's going through your head now? Your department banyak ni. Your department, Hospital Selayang ada 10, ada the 10 bedded ICU bed, and it's there to cater 500 to 600,000 population around Selayang, and it's there to cater 500 bedded Selayang hospital, and it takes patient from intensive care, takes patient emergency head injury from A&E unit, and it also takes a renal dialysis patient who's not very well. So if you were to cut a critical service by 10%, okay, what would you cut? Suggestion? Salary? Do you buang kerja seorang doktor? Do you buang kerja seorang nurses? Do you buang 2 bed ICU, tinggal from 10 bed jadi 8 bed je? Because every bed have got cost, Or do you cakap we don't need to eat nasi lemak anywhere, we just eat, do you cut? So these are the things that you have to think about. And then interestingly enough, the decision to make this sort of the tools, the thinking to make this sort of decisions is a little bit financial knowledge, but a lot of it is ethical knowledge. Is your upbringing, is your background, is your attitude. Like difficultly that word keeps coming up again and again. Is your attitude, is your belief, is your faith, is your religious belief. Do you believe that everybody should take the same pay cut because we are going through really bad times? We all have to cut our salary by 1,000 every month to sustain the department. Or do we say, we need to make a competition? See, we only going to keep 5 of the best doctors, we only going to keep 5 of the best nurses. You do this competition based so that the doctors that you get are very efficient and effective doctors, efficient, effective nurses, who can run service at the less cost but at the same speed. You need to make your decision, which is the best. Are you justified in cutting from 10 bed to 8 beds? Do you need all the 10 beds? These things, a lot of it, some financial, but a lot of it is really ethical, and hold your heart sort of answer and say, can I do this? Right? And the worst thing people do nowadays, unfortunately, is just be ruthless, buang kerja orang, betul tak? You see that? Because the world we live in is a capitalist world. It's driven by capitalism. As long as the top people all okay je, gaji okay, duit okay, bawa-bawa, buang kerja, unemployment tak kisah. And that is spreading into hospital as well. It's really bad. Again, know the ideal, okay, so that you can know. Hopefully you're in that position in the future, what decision to make. So these important factors here. What is leadership? What is leadership? Siapa tahu? Who's the leader here? Okay, mana leader tu? What's leadership? Is it same as management? Yeah, management, some people, the purists will differentiate between leadership and management, but some people would say management is a small subset of leadership. Okay. Leadership is easiest described. It's very difficult to explain leadership. So that's why I asked this question. Sampai dia bagusnya answer, then share with us. It's very difficult to describe. Most people describe leadership with a book. It's not with it's not with a one paragraph definition. With a book, a lot of people describe it with a book. It's best seen in people in the time of crisis. But then again, the good leader as well will show itself, during normal time, and it's got to do with motivating people. It's got to do with making the right decision. It's making difficult decisions, being precise, being concise. It's got to do with all this. So it's described with lots of good characteristic, and then your decision, have to be based on mishwarat or on veto, whatever, whatever sesuai, depends, on circumstances. And leadership is definitely something you can start picking up from now. Definitely, because there's so many head department out there who have got no leadership whatsoever. And then of course you're responsible to create departmental policy or protocols to make sure patients are safe and everything is done safely, and no more bleeding catheter, okay, no more transfusion reaction, all these things, the mistake by the junior doctor earlier, and then the second one have to be feedback head department the next day will pick up, apasal orang ni boleh ada transfusion reaction ni, and then you say, have we have a really robust system of checking, is the patient getting the correct blood? Is there 2 people checking it? Have we screened all the blood for all the antibodies and the factors? Have we screened all the bloods for opportunistic infections? This kind of thing. Head department have to think to try and prevent further problem. Right. I'm just going to finish my talk here. I think I've spoken long enough. I think all of you got bored already. With this slide, just describing things other than what you can learn in university. University, you learn is basic knowledge. Believe it or not, after all the 6 years, it's just basic knowledge. It's just basic knowledge. It won't even make you a safe doctor. Alright? There's two ways to approach being doctor. One is to be a safe doctor. Everybody has to be a safe doctor. But sometimes safe doctor don't do anything. You just don't do harm. I'm not sure how to do this. Get my senior lah. I'm not sure how to do this. Get my. This is a relatively safe doctor because you don't just want to jump in. But then we don't want doctors like that as well, do we? Nothing will get done. So the next level after safety, knowing what is safe, the next level is what is best for the patient. Okay. And to know what is best for the patient, itu yang susah tu. You take a lifetime to learn that, okay? To know what is best for the patient, your knowledge have got to be up to date. It's got to be evidence-based, journal-driven, okay? It's got to incorporate the patient's belief, okay? There's one sect in the UK called Jehovah's Witness. Have you heard of this? Is there a lot of them here? There is in Czech, is it? You know that they can't receive blood transfusion? Yeah, because it's in their religious belief that they cannot receive anything, from another person. If not, they go to hell or something like that, So again, knowing the religious belief, you can't just force your belief into people, okay? Even though this person is bleeding, This person is bleeding, and you know the only thing that can save his life or her life is by giving blood transfusion, and then this person is still awake and conscious. He's got written as well. He's got it written. Most of these people carry a written form in their pocket, in their wallet. I am a Jehovah Witness. I shall not receive any blood transfusion at any time whatsoever, even if it will end my life. Okay? So what do you do now? Do you just impose your belief in patient? Just to save life? Is saving life higher than anything else in this world? Who can answer that? Is saving life sits the highest position in your priority? Yes? Siapa say yes angkat tangan? Siapa say yes angkat tangan? Okay, siapa say no angkat tangan? Okay, yang cakap no angkat tangan. If life not the highest, what's higher than that? Sorry?
Life quality, the quality of life.
Okay, quality of life. Any other?
Principle, belief.
That's right. Principle, beliefs, faith. Believe it or not, sits higher than life. It is like that in British legal system. Hence they respect the Jehovah Witness. It is like that in Maqasid al-Sharia. Have you read about this? Maqasid al-Sharia, the reasons of religion. So these are the Islamic ethics guidance. So it's life comes second. Alright? British ethics, faith comes first, belief comes first, patient request comes first. Kalau patient tak nak, even though this is something that can save their life, and this patient, you have to make sure lah, this patient is not crazy. Or this patient is not, kalau patient macam nak pingsan, then if patient cannot make decision, then save life, boom, turun naik atas. Alright, if you want to know how to make decision whether the patient is mentally capacitated or not, then you can ask my wife later. She's a psychiatrist, so she deals with this. Right? So she deals, psychiatrists have a very difficult job because a surgeon have to decide, whether there's a problem kidney or whether problem arm or whether problem whatever, and then need to operate, or medical doctor, any problem, diabetes, whatever, need to treat medicine. Psychiatrists need to decide whether this person have got sound mind or not. If they don't have sound mind, they can be sectioned. Okay? Even if you read back, you go back to Islamic teaching, if you don't have sound mind, you hilang akal, what happened? Everything falls. All hukum falls. Semayang, puasa, all everything falls. So the implication, what psychiatrists do for a living, is huge. Who wants to be a psychiatrist? Alright. So these are the kind of things, you can who's interested can talk to Kanurun after that. So you need to know your ethical grade. You need to know how to make decisions, decision making tool. This is the challenges throughout your life as doctor. You learn how to make decision, and how do you make decision? You make decision because orang ni sakit, bagi paracetamol tu je ke? And then decision becomes even difficult. He's allergic to paracetamol, or I want to give ibuprofen. And then makes even more complicated because in 10% of cases, ibuprofen will make asthma worse, and this patient have got asthma. Okay, or in that case, give codeine. And then patient said, "Oh, I don't want codeine because people say that codeine can make you constipate." Okay, okay, let's go to So you need to know. Okay, you need to know your priority. You need to work through. You need to know how to make decisions. Either you use Islamic ethics, Maqasid al-Sharia, or you can use Western Greek ethical ethics. It will all, believe it or not, come to the same decision-making rationale. Obviously, Islamic ethics have been around far longer than the Western ethics, but the Western ethics is very popular in medical school. That's what you learn. But at the end of the day, this decision will lead to the same thing. Again, you go back to medicine as and then to humanity as human being. You go to highlight is humanity. And then this I put that in the professionalism and redefine it. Who knows what does it mean by being professional? Maybe people say, be professional lah. What does that mean? When the doctor is being professional, how does doctor behave professionally?
Rational.
Yeah, how does doctor behave professionally? Give me an example. Somebody stand up and say how.
The ideal behavior.
With ideal behavior. That's very good. Because professional doesn't quite fit in medicine. It fit with engineering, accountancy, doing your work, okay. In medicine, it works as well, but it's not complete because you have to have the component of compassion there. Because sometimes your decision is based on compassion. Okay? Most of the time you want to treat a patient to get them better, but sometimes if you are if somebody is so ill and has got a lot of cancer and this kind of thing, and the patient dah macam nazar dan nyawaikan, you don't want to do CPR or do everything, and the patient is already 90 years old, you know what I mean? So there is that component of compassion there, which is added to the medical punya professionalism. Obviously the rest of medical professionality or realism means you treat patient well, you ask patient's opinion, and then you get a good history, you give a good treatment plan, you give patient option. That's also patient-centered care. That's what it means really. Risk management, economy, environmental. Yes, efficiency and effectiveness. Over time you have to be more efficient and more effective. Efficient, meaning you do it in a short amount of time, and effectiveness, what you're doing is effective. The patient don't come again, it's all done. But then that will come with time, inshallah. And then amongst all this busyness, amongst all this objective in life, do not forget your spiritual values. And the only way you can maintain, in my opinion, spiritual values is to be amongst people with spiritual values, of your same spiritual values. Okay? Be amongst people with good spiritual values. Choose your friends well. Choose your wife or husband well. Okay? Because after a certain point in life, nobody, it's very difficult for anybody to tell you otherwise. The best time for you to shape your behavior, the best time for you to shape your attitude is university, believe it or not. After that, your attitude is already fixed. You're already doing what you want to do anyway. Wallahu alam, God knows best. I'm just here to relay what I perceive is important for me to know and important for you to know as well. And hopefully we can all learn from this session, and we can all take the reflection as well. And any further question? Sejam setengah.
Tadi doktor dah cakap tentang GP dan hospital base nya medicine. Kalau teaching macam mana?
Teaching ada everywhere, ada both. In medicine, teaching comes without saying. By definition, you have to teach your junior doctors. The only question is whether you want to do more teaching. If you're interested to do teaching like this in a lecture hall, then you have to be a lecturer with a university, so you can have two jobs, a clinician or teaching, either a GP part-time and also teaching at university, or hospital doctor and teaching university. Some people enjoy teaching so much that they leave clinical practice and they teach full-time like this in lecture hall, teaching first year, second year, third year, but by definition, doctors or medics should teach by definition. If you think you just want to be a doctor, and then after this you go and then you open your private practice, and then you work on your own. I think that is, personally, in my opinion, is a waste, because what you've learned is so difficult and so much. If you just keep it for yourself, it's a waste lah. There's no other way around it. Even a lot of people working in private sectors in Malaysia, they volunteer to teach. They go and join private universities, and then they teach one session a week. This is a modern trend now. A lot of Ampang Putri consultants or consultant, and they go and teach. They volunteer, half a day, whatever, get minimum pay from university, Cyberjaya University, IIUM, UITM, freelancing, whatever. You have to teach. It might come sooner in your life, it might come later in your life, it doesn't really matter. But I think to complete the circle, in my personal opinion, you have to teach. But it is a really good way to keep yourself up to date as well. There's no better way. You don't teach, you get left behind. Wallahu alam.
I would like to know your opinion on the level of patient education in Malaysia. Because I think the problem with preventive care in Malaysia is that the patients themselves are not that well knowledgeable on cancer.
Yes, that's partly true. Patients are getting more educated, especially with the modern one, because there's Google. And then there's iPhone, everybody can Google anything, anywhere. Alright? So partly educated, partly also, you get wrong knowledge from Google. But having said that, things are improving, but you're right. The only way to do an effective primary healthcare system or service is by making the population aware that the system exists, and make them aware that they need to check their blood sugar, they need to check their blood pressure, they need to have healthy eating, they need to check their cholesterol, and there's no other way to do that except from mass media, government involvement, and the One Health care system is involved heavily, by the government. I think Najib is very into this with Satu Malaysia and all this, so that's why it's driven quite heavily over the last year or two. It is a problem, or it has been a problem for many years, but hopefully we are heading in the right direction, but it's still a long way, by no means.
Based on your experience, when you see a medical students, when you see their attitudes, can we guess like whether the student is better to be a GP or specialist from their attitude in medical school? Because some people say that this kind of student is better to be a GP, and this kind of student is better to be a specialist. If you say yes, can you give some example?
About career development and choosing specialty, I think my wife will talk about that in a little bit detail later, so she can probably explain that later. I can probably chip in later as well, because you might get some ideas from that. But people always joke, there's quite a few jokes, if you are brutal and ruthless, you must be a surgeon. And there's always lots of jokes, going around, and then in some way it's kind of true as well, isn't it? Because if a lot of doctors, if a lot of surgeons are brutal, and then if you are so often, you will not survive. So there's a lot of truth in that as well as people joking. But doesn't mean that if you have a completely different attitude you can't succeed. It's just a joke that's real. But otherwise, Kak Nurul or Dr. Nurul will go through a lot of other characteristics as well that you can use to guide, which direction you go. Like for me, for example, I end up what I'm doing because I like everything. Okay, I can't choose an organ. I don't want to be cardiologist. I want to treat everything. And then I want to treat it. So the only thing that's suitable for me is emergency medicine and intensive care. Emergency medicine, I treat everything. Intensive care, I treat everything, but in a lot more detail. If you like to treat everything, but on a population base, on a preventative base, then GP. Otherwise, everything else is specialist. You have to choose an organ. Dermatology, ophthalmology, ENT, respiratory, all sorts, pediatrics. But yeah, if you can choose, you choose the way of the forward is specializing. But I am a generalist. I am hospital generalist, not a community generalist.
Here in the Czech Republic, we are not heavily focused on etiology disease. So usually we will treat patient and we will try to find the etiology and then we will treat the etiology. So that involves a lot of technology, genetic testing and so on. But I find in Malaysia that they like to focus on symptoms. They treat symptoms, which I think is effective. Is that true? I mean, is that difference?
I think in Malaysia they would like they treat etiology as well. They treat the causes of disease as well. But sometimes they at a primary level they try and treat symptoms and signs and make a diagnosis clinically and then treat that. And then to come to etiology exactly involves a lot of technological advancement. And sometimes it doesn't come to anything, okay, because patient come to you with a complaint, and this complaint represents itself as symptoms, and what you pick up when you examine the patient are signs, and then you get the patient impression, what you want to do. The ideal, the ideal solution is you would do both. Because if you find the etiology of a disease and then you give a treatment to the patient that the patient doesn't like, okay, or it's too much side effect, or it's too expensive, or it's too complicated, then it come to nothing anyway. But you're right, the ideal thing is you want to know every single reason why somebody is ill. But sometimes you just don't have any resources to do that. But on the other hand, just treating symptoms and signs without knowing what's going on is also very bad medicine. Alright, so you need to have a bit of both. Okay. Ada.
I just have one question. You were saying that the first thing comes with the patient decision, and then after that, if patient cannot make decision, so there's doctor's role to make decision. So how about family decision? How can family interact with the decision for the patient?
Okay. I give an example because I do intensive care, because sometimes the decision that I have to make in my work is what they call an end of life care. Somebody is very ill, say road traffic accident, and dia langgar, and then dia punya tengkorak, he's got a fractured skull, and then inside he got a brain contusion with raised intracranial pressure, okay, and then the patient is put in intensive care. The patient is young, say age 30 or 40, put in intensive care, and then the patient has been on intensive care for about a week, showing no signs of recovery, okay, showing no signs of recovery. And then you would do a brain stem death testing on the patient to decide whether the patient brain stem is dead or not. Okay, you will learn all this inshallah, with time, and then you will talk to the patient's family. Obviously you can't talk to the patient anymore because the patient is unconscious, not making any recovery. Okay, the patient cannot breathe on its own. You switch off the ventilator. If you switch off the ventilator, patient will stop breathing because the brain stem is dead. There's no automated respiratory movement anymore. So and then you talk to family. You talk to family. You say, he's young. We've tried, for 1 week, showing signs of recovery, and then family said, but he's still alive there, isn't he? Alright? Family said, he's still alive there, still heartbeat, still blood pressure. You're keeping him alive on ventilator, he's still alive, isn't he? Alright? Is he still alive? Why is he not alive? Yeah. And which brings us back to our faith. What is life? Is life defined as a heartbeat and breathing? Is life defined as a conscious of mind? Is life defined as a presence of heart and feelings? Okay, you will find all sorts of definition, Islamically, ethically, philosophically, a lot of them will come about to roughly about the same thing, and it is very difficult. So most countries would define it legally, because subject of life and death is highly complicated. We can't even sit down and agree what is alive and what is dead. Can you believe that? Medicine dah berapa ratus tahun. Because the clear-cut alive one is clear, like me and you. The clear-cut dead one is also clear, right? It's the borderline one. Okay, so you define things legally. So you have that, to think about. And then of course, sometimes, a lot of times, you speak to family. You explore family options. You explore organ donation option pula. Dalam susah-susah macam tu, you nak mention pula tu family, cakap, your son ni is brain dead, tapi can we have his organ? We can donate his organ to other people and save other people's life. How do you actually say that? How do you actually say that in that situation, after telling the family that their son is dead, even though they think the son is not dead, that you want to take the organ, or you want to request them to give the organ so that you can give to somebody else to save somebody else's life? Alright? And then you speak to family, you go down this road, you talk, and this is when attitude, communication skills, again not taught very well at medical school, your experience, your faith, your religion, your belief, your compassion, your ability to respond and to react to the family respond. You can't just have a standard approach to go in there. Some family jerit-jerit meracau-racau when you tell bad news. Some family cry. Some family jadi marah macam nak bergaduh dengan you. Some family terdiam je, tak tahu cakap apa. So you learn as you go through. Nobody can teach you any of this. Okay, so you learn as you go through. But again, you know what is the ideal, because the ideal you can learn. You know what is your faith. You know what is your belief. You know what is right and wrong. You know, if you keep sustaining this person's body on the ventilator, you know that he's not going to wake up. You know is not going to do anything. You know that because you have CT scan, you have brain stem testing, you have EEG. How do you translate that into word to make it into more comfortable? And the patient is not alive. So family's opinion is very, very important, especially in that circumstances. But if patient is awake, alive, talking with full mental capacity, alright, with full mental capacity, is patient's punya own body. The only time you can overrule what patient wants or needs, if psychiatrists come along and say, this patient is in mentally not right, then you can treat. Itu pun you can only treat the mental condition, you can't treat the physical condition. If the patient have two things happening at the same time, you know what I mean? So patients always comes first, family come second. The ideal is everybody agree, betul tak? Again, knowing the ideal. Sometimes you need your political discussion skills, your negotiation skill to make even the family agree, to make the family agree with you. So that's it. See, 10 years ago I wouldn't think I'll be doing this job. But alhamdulillah, that is part of my job, and it is very difficult job, and somebody have to do it, but you have to understand. But in every other specialty as well, it's very difficult. Say cardiology, okay? Cardiology, if you have a heart problem, heart attack, and then you do angiogram, and then when you do the angiogram, you think blood vessel dia teruk sangat rosak ni, you can't you can't taruh stent, you can't put a stent in there, and what you do, you want to do heart bypass. Oh, he's 75-year-old, can he survive 3-hour surgery, or being on a bypass machine where your blood have to be diverted outside your body to bypass the heart. Okay, that's what a bypass machine. So, and then you have to make every specialty have got its own difficult areas. No specialty is safe. In other words, GP lagilah banyak benda-benda macam ni if you discuss, because GP is even more difficult because the patient, but this primary, diabetes, blood pressure, they don't feel ill. Tak rasa sakit, kan? It's not painful. So how do you convince somebody who don't think they're ill to take certain medication or to change certain lifestyle? At least my patient is obvious in front of their eye, this patient is very ill. So every specialty have got its own difficulty, and then you have to rise up to the challenge, and you have to use everything that you learn all your life to try and make decisions. Allah. Is that answer or not really? Okay. Allah. So hopefully again we would have gained something from there, myself as well. Again, just to say, I'll be around all day today until later today. So you want to talk about anything philosophical, religious, specialist, family, whatever, whichever time, kalau ada time we can talk some more. And kalau ada sessions, kalau you have some more questions, you can give it to organizer. I'm sure kalau ada few spare minutes at the end of the day, we can always address it some more. But hopefully the few sessions after this is all more practical, is more on the ground punya knowledge rather than so philosophical. But I think it's very important to know the philosophical question first, the bigger picture first, because this will guide how you proceed with life, inshallah. And I would apologize if during the talk, I want to apologize if during the talk I would have accidentally insulted anybody or said the wrong things, and may Allah forgive me, and may we all inshallah be successful in this world and in the year after, inshallah.